One of the things we're trying to do is get the discussion around this away from rescue to more immediate use.
Mm-hmm.
And we've made a concerted effort as a company to say, okay, we need to start talking about immediate use because a lot of these adult patients don't want to be rescued.
Yeah.
They don't want to feel like they need to be rescued.
Absolutely. So that immediately you go, oh, I don't need that.
That's why they wait too long.
That's why they wait too long. So immediate use medications.
Yeah.
Hey, I'm Greg Grunberg, and welcome to Talk About It, the podcast where we focus on topics that everybody should be talking about, and hopefully they will be. Not only talking, but screaming about.
Epilepsy shouldn't keep you from doing anything that you want to do.
Talk about it. Talk about it.
While we will continue our focus on epilepsy, of course, we will also look at other health conditions and causes. Our goal is to knock down, drag out, and eliminate stigma and raise awareness. Each episode, you're going to hear from amazing advocates and champions. You will learn, as I will, about how we can all help to make a real difference.
Talking about it is important. It's all about connecting.
Talk about it.
Talk about it.
Talk about it. Talk about it. Thank you for talking about it.
Thank you for talking about it.
Talk About It is sponsored by Seizures Are Signs. Seizures Are Signs is dedicated to educating those living with or caring for someone with uncontrolled seizures about the importance of early diagnosis, recognition, and treatment. To learn more, please visit seizuresaresigns.com. Seizures Are Signs is made available by Jazz Pharmaceuticals. All right, so let's jump right into this episode of Talk About It. Welcome to another episode of Talk About It. Now, there are certain things that we don't talk enough about. I mean, there's a lot in the epilepsy community and the seizure community, but one thing that's very important that we need to discuss with our doctors that you should have with you all the time is called an immediate use medication. We used to call them rescue meds. So we are lucky enough that we had Craig Chambliss, the CEO and the founder of Neurelis, the company that makes Valtoco, one of the immediate use medications, to sit down in the studio with us right here and talk about it. He's a fascinating guy. He brought his amazing son, Tristan, and this conversation, I think you're going to love. Thank you so much for taking the time, for sitting down, and you know, it's a surprise guest. I love that you bring your son.
Yeah. Guest of honor here.
Guest of honor, exactly.
Yeah.
So I just want to know everything about your journey, how you got to where you are right now. And then I think in that, a lot of people will learn you provide so much hope in the medications that the company's making. Jake has it with him. There's a confidence that he has that it's like, okay, if God forbid something happens, that puts him at ease, probably lowers triggers, Anyway, I recommend anybody ask their doctor about rescue meds. You have to discuss this. Yeah. You have to talk about it. How did the whole journey start for you? Let's go all the way back. Give me the origin story.
Oh, my goodness. All right. Well, first of all, it's just a pleasure to be here. I mean, I'm a big fan of everything that you're doing here. It's so important. And I think if there's anything that needs to be done in the epilepsy community it's conversations, especially amongst the adult patients in this thing. So it's just a treat to be able to be here.
Thank you. You're not allowed to have a better voice than me. I don't understand what's going on. Nick, can you alter this, please?
A voice and a face for radio. Exactly.
Oh my God, you have such a great voice. You remind me of a buddy of mine who calls the Dodger games. Todd Leitz. He's my buddy, and it's like, now batting. Can I just hear it? Just give me one.
Now batting.
Come on!
There you go.
This is what I'm talking about.
There you go. Yeah.
Wow.
That's my second career. After
Yeah. So take me back to the beginning of your career.
Yeah, I think there's probably three distinct moments on this journey that really kind of caught me. So I've been in this industry, the biotech and pharmaceutical industry for 32 years now, and involved with a lot of different therapeutic areas. And I went to work for a company called Elan in the late 1990s, around the turn of the century. And they at the time were the premier epilepsy company. And I ended up, by happenstance, at Children's National Hospital. And something just struck me there, because having been involved with cardiology and urology and endocrinology and all these different oncology, all these different areas, I was so impressed by these pediatric neurologists, the nurses, the staff,
Yeah.
how much time they took with these families who were at such a turning point in their lives. Like they were being met, their entire worlds have been rocked. And the empathy, I was like, wow, this is where I want to stake my tent. This is it.
I love it. I talk about this all the time too. Like there's no billable hours with that.
Yeah.
They pick up the phone, they text, they respond to emails anytime. And it's not because it's me. I talk to other patients and other caregivers, and they're like, yeah, I mean, there is. And also, a lot of these people have been affected, and then they get into, maybe not a lot, but I've met quite a few, though, that are like, yeah, our family dealt with this, and I just devoted everything I could to this.
Right.
So you were really struck by that.
I was struck by that. And we had the chance, after an acquisition, a few of the executives split off to start a company called Excel Pharmaceuticals, and I kind of helped them pull Diastat out of Elon, and we launched Diastat back in 2001.
Wow. Okay.
So, I mean, that's really kind of where this whole story was kind of born. There's a lot of excitement about, amongst the top doctors and about us getting the word out about, outpatient management of these prolonged or cluster seizures. And we were excited about it as well. And it was the first meeting we had in our office in San Diego, where we had Jim Cloyd and Jim Wheelis and Tracy Glauser and Kevin Van Landingham and some others that they kind of pulled me aside and said, hey, look, it's great that you're doing this, but Diastat is a younger pediatric product, and this is not a younger pediatric problem exclusively. This is a problem for the full age range. So they said, come up with an intranasal version of this product, and you're going to solve for this. Because
that was when?
That was 2002.
2002?
Yeah, 2002. And that was on the heels of our first, meeting as a company, where we got together out in Phoenix. Mm-hmm. And Georgia Montouris came to talk, and she offered to bring one of her patients' mothers to have a conversation with the company and just kind of talk about her experience. And I'm like, sure, yeah, bring her along. That'd be great. And so, Georgia came and she addressed everybody, talked about some of the clinical trials that she did with Diastat, which was very impressive. And then she introduced Karen Lane. And Karen, if she's out there, she just changed the trajectory of everything, because she got out there and started talking about life before Diastat with their little 2-year-old son. And they were tethered to an emergency room in St. Louis. They never traveled outside a half-hour radius of that emergency room, because he was having seizures on at least a weekly basis. And so they knew they could get into that emergency room. They'd take him back right away. They'd hit him with an IV. They'd stop the seizures. They'd call Dr. Montouris. He'd get stabilized, and he'd go home. And
so there was nothing that you could carry?
Nothing at that time. And it was rinse and repeat. And then Diastat was approved. And she said that Dr. Montouris called her and said, look, there's this new product. I wrote your prescription for it. I want you to go get it. Next time he has one of these seizures, give it to him, but still go to the emergency room. So they did. Mm-hmm. And he had a seizure. They gave him the Diastat. On the way to the emergency room, the seizure stopped. They got to the emergency room, checked out. Everything was cool. They went home, talked to Dr. Montouris. Next time he had a seizure, which was like days or a week later, she looked at her husband and said, let's just stay here. She gave him the Diastat, seizure stopped. And then she goes into the story about how this little boy's world just opened up. They were able to go on family vacations. They were able to travel around the world. And we're all just in tears. Yeah. I mean, it's just I'm looking at this room full of people going, wow, something just dramatic changed here. We have like a mission now. Yeah. To bring this to more families and get the word out about it. Yeah. And it was dramatic because, like, after that, everybody was volunteering for summer camps, and we were supplying the products so kids could go to camp, and if they had seizures, they had Diastat, and it was amazing. But it also was kind of the beginning of that quest to figure out how to formulate an intranasal version of Diastat.
Coming up on Talk About It.
So to take that 25% and potentially with wearable predictive technology, expand that to 60 to 70% of the epilepsy refractory population.
Yeah.
Oh, man. I mean, then you're talking about getting people's driver's licenses back.
Yes.
Then it kind of opens up. People are going to be more willing to, I mean, if you cut the number of seizures out, if you stop these seizures proactively, in some cases, people are going to be more open to actually discussing it. Because
100%.
For people with epilepsy,
Seizures are unpredictable.
seizures striking without warning, even if you are well controlled, can impact your daily life.
Seizures are unpredictable. Even if you're well controlled, you still need to know what to do.
Even if you're doing everything right with your treatment,
A breakthrough seizure can still happen.
You gotta know this stuff.
you need to be prepared and know what to do. Know your options.
Talk about it with your doctor.
I'm Lake Bell.
Soy Efrain Antonio Ramirez.
I'm Duff Golden.
Now that you know, talk about it.
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 Familia, talk about it.
Talk about it.
Visit talkaboutonvideo.com.
So when Jake was younger, right, he would have a seizure at school, and the teachers are like, "There's no chance." They had Diastat, the nurse had Diastat, but they're not going to give it to him.
Yeah.
So I would get, on my phone, it would say the LVUSD, the Las Virgenes Unified School District, and I was like, oh, my wife knew right away. We'd get there, and he'd be laying there in a pool of blood because he cut his chin, and they don't want to touch him because of broken neck and a possibility of whatever. I mean, it's just like, so it really falls on you. As soon as when we had Diastat with us, and by the way, there have been a couple times when we forgot even Diastat. We were at Disneyland, and Jake had a huge seizure and wouldn't stop, and he was really, really young. And I'm carrying him out, and all these people are looking at us, and it was just horrible. He had to be airlifted to UCLA.
His sister, my youngest daughter, when she was 3, she spiked a fever. She had a MMR vaccine like the day before, and she just immediately spiked a fever, and it blossomed. Thankfully, we were all at home. Mm-hmm. She had a seizure, a febrile seizure, and I'm like, Mr. Seizure guy, I'm like, hey, everybody, it's gonna be fine. It's gonna take a minute or so. Everybody, calm down. The
it's
whole
still
family.
Your daughter, though, Craig.
Still
Come on, you guys must have been freaking out. Were you there?
No, I was.
Well, you were there, but you were.
Oh yeah, you were so little.
You were 2 years old. You didn't remember. You were probably upstairs playing or something.
Are you the baby?
Yeah.
Yeah, he's the baby.
Okay, he's older than me.
Okay, so we gotta. But okay, so
she's like 7 months older, not much older than him, but
yeah, and you have 27 kids. So
yeah, exactly.
That's a lot to keep track.
That's a lot to keep track of. But there was a good crowd around that,
right?
And yes. I'm trying to keep my wife calm because she's freaking out of her baby. And I said, well, let's call 911. Let's get them here. They came. They gave her an IV of midazolam.
How long had that seizure been going on?
It'd been going on for about. The emergency services were there so fast; they were there within 5 minutes. But I noticed because I'm running to the hospital with her, I'm like, she's still seizing. And I get to the emergency room at our local hospital here down in San Diego, and they've got her there. I'm like, she's still seizing, and they're like, no, she's fine, she's fine. I'm like, no, she's still seizing right now. She was unresponsive and everything. And her pediatrician came in, who was just a fantastic guy, and he took one look at her and goes, she's still seizing. I'm like, thank you.
Wow.
And they say, we want to do a spinal tap. And I'm like, no, we're going to Children's Hospital.
Yeah.
Let's get the ambulance ready. We're taking her downtown. I want the best care for my daughter here.
Yeah.
And Children's Hospital was full. And but thankfully they had a reciprocal arrangement with the Naval Hospital, so we were able to get her to the ICU at the Naval Hospital. Yeah, and we spent the weekend there with her, and had just an amazing group of friends that kind of came in and watched the rest of these kids for the weekend.
Yeah,
but
I went to San Diego State, by the way, so
awesome.
You can make all the San Diego references you want.
There you go.
I love San Diego.
There you go.
Yeah.
Well, we got her stabilized, and we left. And before we leave, I'm like, I'm not leaving without Diastat. I said, there's no way.
Yeah.
And they're like, without what? I'm like, oh my gosh.
I know.
I said, get your pharmacy to order it and get everybody that's on staff in here. We're just going to do a little. This is long after I stopped, talking about Diastat or promoting Diastat.
Yeah.
I wasn't working for the company anymore. And I said, we're going to have a little sit down and talk about what this is and why in these situations you should be sending people home with
Right.
with something to be able to do,
100%.
especially if they have a history of prolonged seizures. But the one thing that impressed me about that is she had a prolonged seizure, a single prolonged seizure, and we were very aware of our kids' development. 7 kids, you're kind of like measuring up against each other, like who's learning what. She lost 9 months of her life there. I mean, all of her learning in the last 9 months was just wiped out.
Unbelievable.
And I'm thinking, and it was just emphasized to me, is like, if a single seizure can do that, how important is it to stop these seizures as quickly as possible?
There's such a stigma with epilepsy and seizures that you don't talk about it, and also the fact that seizures look different.
Yeah.
They don't all
very different.
look the same. Okay, so you go through this incredibly traumatic thing with your family, and at that time, where were we in the process of Valtoco, or even trying to develop something?
We were just going into initial clinical trials and just trying to get funding for the company. I mean, it was a labor of love, and God bless my wife and the sacrifices she was willing to make for this dream. But it gained added significance with seeing her daughter seizing in the middle of the family room floor.
Right.
But it was early in. I mean, this was 2010, I guess it was. So we were just getting some angel funding to get things up and going.
Are you hopeful for the future of medications, given you obviously know everybody at the top levels of all these companies and what they're working on?
Yeah, no, it is. There's so much more hope now with kind of tailored gene therapies and precision medicine that we didn't have 10 years ago and 5 years ago. I was around when I first got into this. It was 2000, and we were getting ready for limit all these products to come onto the market that were going to just eliminate the refractory epilepsy population. And it was like, everybody's like, all right, there you go. It's now
cure.
30 to 40% of these patients are refractory, and it's just going to disappear overnight in the next couple of years. And that piece of the pie hasn't changed at all.
Yeah,
not at all. But now we have some. It's the amazing work of some of these advocacy groups and research, and just with all of the tools at our disposal, we can get very targeted in terms of delivery and with new pathways to really address, especially some of these severe encephalopathies. It's an exciting time. And that's one of the things that we're excited about, and why we wanted to kind of expand beyond Valtoco. We thought it was just a great, foundational product for the organization. And it's really kind of indifferent to the type of epilepsy, indifferent to the chronic therapy that they're on. So we get to play with everybody, and respect everybody in the space, and kind of be, all locked in arms trying to make an impact on this. So, and we want to continue to do that. I mean, we know the importance of treating these seizures acutely, that the ones that require, and the ones that last a minute or two, like you were talking about earlier, that you can say, this is going to be done.
Yeah.
They don't need treatment. It's the ones that you start to see the pattern, and, it's all individualized to the patient, but the caregiver recognizes it. The patient, if they have the aura that is indicative of that, they recognize it. Those are the ones that need to be treated quickly.
Mm-hmm.
And so to take that 25% and potentially with wearable predictive technology, expand that to 60 to 70% of the epilepsy refractory population.
Yeah.
Oh man. I mean, then you're talking about getting people's driver's licenses back.
Yes.
Then it kind of opens up. People are going to be more willing to, if you cut the number of seizures out, if you stop these seizures proactively, in some cases, people are going to be more open to actually discussing it. Because
100%.
And when I know when Bruce was on, he talked about 2 patients up on the stage who had kind of said, "Hey, I've never talked to somebody who had a similar disorder as I do."
Right.
And it's the same thing. When he said that, I'm like, it's the exact same thing we see in this adult market research. We get these patients together, and we have just a kind of a round table to hear about their experiences, and it turns into a therapy session because they're so isolated.
Can we please do that here?
Yeah.
Well, look at this. I got 4.
Exactly.
I would have brought my son today if I had known. But what a great thing.
Yeah, it is. It's just like and it's just so. There's such a need for that level of discussion, because people are kind of left to kind of fight the battle on their own.
Yeah.
and then seek out resources, and the ones that actually are able to reach out. There's tremendous resources available. Hey, here we are.
Yeah.
But they feel so isolated.
Absolutely, and alone.
And
when you do get together with the caregiver series that I do, right?
Yeah.
When I get together with other caregivers, there's a shorthand immediately.
Yeah.
And it's like, there's such a relief. It's like we give each other a hug without hugging. I look at them and just like, oh man, you get me.
Yeah.
And even some, neurologist, epileptologist, I don't have that with. I mean, I love them. They're all heroes to me, but it's bedside manner, it's this and that. But when you're a caregiver or you're a fellow patient, there's just an understanding where it's like, okay. And I think it is scary to see someone have a seizure. If you're not familiar with it, I mean, I alluded to it. It's like, I don't want people to know as much as I have been educated in this. But at the same time, there is a certain level of education that everybody should have.
Yeah.
It's very simple.
Absolutely.
Coming up on Talk About It.
The dog that they had would predict his seizures within 10 minutes. He would go up and tap on the soccer coach, and the soccer coach knew he had 10 minutes to get that kid out of the game.
Oh my God.
That's really the goal, is how can we replicate that with a very discrete wearable technology?
Yeah. You might be listening to this and thinking, I really don't need an immediate use medication. I'm not a doctor. I'm not prescribing a certain medication, but as a caregiver, I can tell you that the moment you get complacent is the moment you need the security of having one of these medications with you. I implore you, talk about it with your doctor. Just say, I want the peace of mind of having one of these. Trust me that when you least expect it is when a seizure is going to continue. We have experienced it. Thank God we haven't experienced it in many, many years, but it does happen. And when you have that medication, when you need it, that's all you need to know, is that it's there for you and it will help make it stop. Immediate use medications. Discuss it with your doctor. Here's the other, I think, part of the population in the seizure and epilepsy world that we need to reach is the well-controlled. Because just because you're well-controlled now, there can be a breakthrough seizure. I mean, your daughter, never again. That's it, right? So somebody can be, oh yeah, I haven't had a seizure. These numbers again. I haven't had a seizure. I'm seizure-free for 10 years. Okay, but just carry this with you. Have a rescue med with you in the house somewhere. Just God forbid, you have other things. I mean, it's not like I take Tylenol. I don't take it, but I have it in the house. In case I get a headache, I have it there.
One of the things we're trying to do is get this the discussion around this away from rescue to more immediate use.
Yes, sorry.
No, that's fine. It's something that we've made a concerted effort as a company to say, okay, we need to start talking about immediate use because a lot of these adult patients don't want to be rescued.
Yeah.
They don't want to feel like they need to be rescued.
Absolutely.
And so it's something that we're working on right now. Not that it affects anything that we've done.
No, but it's important because that term rescue med, no one wants to be in a situation that they need to be rescued.
Right.
So that immediately you go, oh, I don't need that.
That's why they wait too long.
That's why they wait too long. So immediate use medications.
Yeah.
That's the term that we need to get used to.
The goal is to eliminate seizures. And stop them where they start, and because there's so much downstream implications. I mean, because we did a retrospective analysis of that huge seizure study, where we looked at the interval between seizures over time. So patients that came into that study were having the type of seizures that required intervention every 2 weeks.
Okay.
Fast forward a year later, they were having these seizures like once a month. So they cut out half the seizures. And the quality of life scales were all stable or improved, which you just don't see in long-term epilepsy studies.
Right.
But it shows, I mean, it's kind of a unique problem. I'm trying to promote, I mean, it's just acute treatment for these seizures, because if you do it, you'll need less of it downstream. I mean, these were like some severe encephalopathies in this. I mean, it was just kind of a mix of patients in this, and, kind of pulling out, any patients who had medication changes. It was really intriguing data.
And also, I mean, look, your daughter lost 9 months or so of development. An adult is going to lose something. It's not permanently, hopefully, but you just don't want to seize. You just don't.
Right.
You want to stop that. The other area that I think would be really, really interesting is to partner with the seizure dog community, because the dogs can detect it way before. And if somebody has Valtoco, their dog is freaking out, and they know, oh, this has always led to a seizure. Boom. Because if Jake doesn't get
was that a lead-in to our
what
our partnership?
You have a partnership?
Yeah. We had we brought
Great
up
minds. Come on, Craig.
right there.
Come on, baby.
Right there. Val and Toco are our two labs seizure dogs that we brought up at. And
wait, are you kidding me?
No. It's and
that's awesome.
Val is the female. Toco's the boy. Toco was a bit of a flunky. He didn't make it all the way through the program, but he made it far enough to be placed with a family that's coming up here very shortly in Hawaii. And it's just an amazing It's just an amazing story. Corey Liao in Hawaii is just
Man, it really pays to flunk out. You get to go to Hawaii.
He gets to go to Hawaii,
exactly.
And with an incredible family, with an amazing story. And then Val, she's continuing through the program, and she's getting ready to be placed with a family. So we partnered.
I love that
on this front for that.
So I'm a pretty smart
reason.
guy.
You're a very smart guy.
Once in a while, Nick, are you hearing this? Okay, oh come on.
Yeah, agitated.
I mean, it's really,
remarkable.
Really smart.
Yeah, it's remarkable because I'm sitting here talking to the people who are training us and the director at the program, and she's talking about how her son had seizures as a teenager. He's outgrown them. He's doing charter fishing trips out in the sea, so he's definitely cool now.
Right.
But when he was younger in high school, he was a soccer player, and it's just phenomenal because the dog that they had would predict his seizures within 10 minutes. So he would go up and tap on the soccer coach, and the soccer coach knew he had 10 minutes to get that kid out of the game.
Oh my God. That's
and
incredible.
I'm just like, I mean, the capacity of these dogs is just amazing.
And the coach is like, not now. He's on a breakaway.
Yeah, exactly.
Come on, baby. All right, good. All right, bring him out.
It's just
unbelievable.
It's just phenomenal.
That is. Now, what is it that dogs sense? Do they sense?
We don't really know. I mean, they don't really know. It's all really kind of theorized in what they sense, but
they're accurate.
But
right?
they're accurate.
And they're trained in the house.
They're so well trained in this. Unfortunately, you just can't train them in mass. These dogs are in very kind of isolated circumstances and social conditions for years.
Yeah.
Until they reach a point where they can be placed, and they get trained on the scent of somebody who has a seizure. They after seizure, they're breathing into a cloth. They're sending that off for that dog to be trained on to recognize that seizure.
Interesting.
What's in there? We don't know. But that's really the goal is how can we replicate that with a kind of a very discrete wearable technology.
Yeah.
That is, because the algorithms exist now that are pretty accurate for seizure prediction in so many cases. But what's the wearable device that's not a halo that patients have to wear?
Yeah,
watch can't measure it.
Yeah,
really.
or a deep brain implant.
Yeah, I mean, definitely with that. But there's some advances being made. I think we'll see something in the next couple of years.
So I think we have the name of this episode has to be "Make It Stop."
There you go.
I mean, I think that's
so great.
That's what it is. This episode is "Make It Stop," and you've been doing that. I mean, it's got to be really rewarding. As we're just wrapping up, it's got to be so rewarding what you're doing, and it's rewarding for everybody in the epilepsy community. I know, and the breakthroughs, and you hear the stories. This medication saved my life, and this and that. And I have a normal life, whatever, but. You're at the point of emergencies. This is like life and death for some people, and I mean it's pretty impressive. It's pretty great.
It is a worthwhile venture to say the least. That's why a lot of the people who were in that room 22 years ago are working at Neurelis now. Same people.
Yeah,
because it got its hooks in all of us, and it's like this is something important because this and we get together every corporate update, like every 2 months, and part of the hallmark of that is sharing stories, that how people's lives were changed as a result of.
Well, any story that you have that you say, what, I'd love to feature, and I mean this, just please tell us, because we're always looking for someone to sit here and talk about how I didn't I didn't know about rescue meds, and then I carried it, and thank God I had it. And
Yes.
it's just because again, it's you can see yourself, or patients can see themselves in another patient and go, oh, you know what? I don't want to wait till that happens or whatever.
Yeah.
And you, fella, I mean, I know you're a great volleyball player, but you got a pretty cool dad, dude.
Yeah.
Thanks for taking the ride up here and coming and hanging. I can't thank you enough for just everything you're doing.
Oh, thank you. Because I mean, it's a concerted effort across the board, and I think it's what you're doing is perfect in terms of the need that exists out there, and because there's just such. I mean, one of the challenges we have is especially in these adult patients is they're seeing a doctor once or twice a year because the demand for these physicians they're phenomenal, and they've got a 12 to 15 minute interaction. And so they need to be talking about it so they're making the most use.
Yeah, Nick, you only have 12 minutes.
Yeah. It's amazing.
So the nurse practitioners, by the way, are heroes as well. I mean, they're the ones that are in more constant contact, I think.
And that was one of really the challenges with COVID and these offices shutting down. That process of a patient working through an office and just getting those touch points all along the way.
Yeah.
They get 12 to 15 minutes with the doctor, but then they have the expanded time with the staff, and everybody is. I mean, it was tough. It was some tough times, and it's good to see it coming back.
Good to see you guys. You've earned a hat. Congratulations. We're not sending you to Hawaii, but you do get a hat.
All right.
What do you think? Colored hat. Take one of each.
You're a colored hat guy.
I like the color one.
And
I like the. That's awesome.
I know.
That's
very,
awesome
very
guy.
cool.
I love
we
it.
have others, but thank you, and hopefully we can continue this relationship with if you will suggest people. I mean, honestly,
I will do that.
I'd
definitely
love it.
do that. Yeah.
And thank you for everything you're doing to support the community.
Oh, thank you.
It's just important.
Thank you. Thanks, Nick.
Yeah,
Appreciate it,
thank
too.
you.
Thanks for nothing, Nick.
You guys are awesome.
Well, that's a wrap on another episode of Talk About It. Remember, we're all human. We're all dealing with something, and a little compassion every day can change so many lives. Thank you to our special guests. Special thanks to our sponsor, seizuresaresigns.com. Thank you to J.J. Abrams for our theme music. Thank you to Nick Marzak for producing, directing, editing, and incidental music. On behalf of my fellow producers, Phil Gattone, Ken Lohenberg, and Nick Marzak, thank you for listening. Thank you for watching. And if you're not watching, go to talkaboutitonvideo.com to watch these episodes. They're now on video as well. I'm Greg Grunberg. Don't forget to talk about it, and I will see you next time. This podcast is a production of the Talk About It Company.